Pleasure to welcome you all here this morning. My name is Jared Rathie. I'm Vice President and Market Lead with Press Ganey. You're in for a real treat this morning. In today's session, we're going to dive into how Press Ganey's age segmentation report has inspired a more personalized and impactful approach to patient engagement. Our speaker will share insights on tailoring patient care strategies based on age demographics and how this approach leads to deeper, more meaningful connections with patients. It's my honor to introduce our speaker, Mel Carrillo from the Queen's Health System, who serves as their Manager of Patient Experience. On a personal note, Mel, I have been doing this work for 20 years. Mel is by far and away the most passionate patient experience professional I've met. We have a lot to learn from him, and I would like to welcome him. So let's put our hands together.
Thank you, Jared. Thank you. Will do. Because I think what I have to share are things that you can bring home and create meaningful change for the patients that we all serve in the communities that we do business in. So my name is Mel. I'm a registered nurse for over 2.5 decades. I'm a certified patient experience professional. Been doing this work now for about a decade. I have 3 learning objectives. The first one is to describe how we're going to create and execute a volunteer strategy that's going to make a difference. Also, I'm going to describe transformational team-based practices that are really going to help you achieve outcomes, and we're going to discuss the strategies used to create the program. So let's dive into the Queen's Health Systems. If you notice it's plural, it's because it's many different companies that create it, but I always want to ground it in our mission. We have a rich, rich history. We have care values. They stand for compassion, aloha, respect, and excellence. Queens by the numbers, for all those that want to have like one nice little infographic, we are the only level 1 trauma center in the state of Hawaii. So what happens if you're a level 1 trauma center, we turn you away? Where's the next level 1 trauma center? Oh, Los Angeles, California, Washington. We sent our burn victims recently to Arizona, to your hospital. Thank you for taking them. And you can see this partnership that we have. And it's about 2,000 miles. We're about 729 licensed beds. We're going to be building a new hospital from ground up in North Hawaii, or the Big Island. So we're excited, in Kailua Kona. But how many of you went to school and seen this map? This map is a condensed version. I always thought Hawaii, the little orange speck, was south of Texas. Because I was from Jersey. So yeah, all right, Alaska and Hawaii is there. But did you, I have to say, did you know that there's also US territories? We're most familiar with like Puerto Rico, Virgin Islands. But take a look. You got Palau, you have Guam, you have Marshall Islands, and all of those smaller islands that are in, discovering Queen Emma. I'll say 7 years ago, our team stood up on this stage at your national client conference for Press Ganey. And Jason Chang, who was our chief operating officer at the time, is now our president and CEO. And Wanda Sharp, our system director for patient experience, spoke about launching the Queen Emma Way and creating a unified approach towards how our people at Queen's Health Systems view patient experience. So in 1859, imagine this, you're 21 years old, leading a nation, leading the Kingdom of Hawaii, 21. And her people were dying in a pandemic. You guys can all relate to this. About 80 to 90% of Native Hawaiians were dying because of whooping cough, venereal disease, Spanish flu, measles, polio, you name it, they were getting it. And Queen Emma went door to door to crowdfund $16,000 at that time to create the seed money for the Queen's Hospital on a property in Honolulu, Hawaii, that we call Mana Mana. So you might see Queens Medical Center Mana Mana, or you might know us as Punch Bowl. Punch Bowl is the name of the street that we're on. Mana Mana has higher cultural significance. In Hawaiian, mana means power. Mana Mana means the power of the collective, has a second meaning, also means to branch out, which is why we continue to grow our services. We're in Kauai, we're in Maui, we're in Oahu, we're in the Big Island, we're in Molokai, and we continue to. So a couple of attributes that our queen had was caring for the sick. That was one of her primary duties. When she built the hospital in 1859, and by the way, we would have been the 37th hospital in the country if we were recognized as a state at that time. But we were the Kingdom of Hawaii, and then we were recognized as a state back in, anybody know? 1959, about 100 years later after the founding of Queens Hospital, which is now known as the Queens Medical Center. So interesting enough, it's got a heritage. The other thing that she was known for was acts of loving kindness. She was known to actually do interval rounding with her patients. Before we called it that, and before we called it purposeful hourly rounding, before that, she just sat down next to her people, regardless of who you were, and she talked with you, she connected with you, she cried with you, she laughed with you, and that's what made her so special, and that's what made her so ahead of her time. And it's so important, and I promise you it's all going to connect by the end of my presentation. But I had to start where we began 7 years ago on the Queen MOA. We have our service behaviors that all 9,200 plus team members are Ohana members. Who knows what Ohana means? Yes, family, exactly. You guys have watched, what is that, Lilo and Stitch? Right. That's my reference before moving over. But these are our service behaviors for everybody, and then we have our clinician behaviors, which, by the way, are backed up through the solution starters at Press Ganey. This is where I work. This is the Queens Medical Center, Honolulu. How many people have seen this campus? How many people want to see this? I do tours. And what you can see from this photo alone, you can see how well manicured, how tropical, lush, beautiful, right? The respect of the aina, or the land, right? So if you can imagine how it looks outside, you can only imagine what the patient care must look like inside. It's got to match, right? And that's why I am here to speak to you. How can we do things differently to impact change of our patients utilizing what we have? Because in Hawaii, because we're so isolated, we're super resourceful. And because we only have what we have to be innovative and break down the silos. And you all can do this too. This is when Angie Smith, which, bless her heart, I wish she was here. She's our advisor at Press Ganey. She's been part of our Ohana for about 5 years, and she's been doing this work for Press Ganey for about a decade. She shared with us this age segmentation report. My data heads, where does your eye already go to? The right-hand side. So this age segmentation report takes a look at the entire population, divides it by segmentation of age, and then the unfavorable from the mean, or the average, is red, and the favorable answers are in the blue. I know you can't read it, but you can tell which age group has the highest vulnerability, the biggest disparity. 80 and up, actually, yes. And what's the next age group? Okay, so in Hawaii, we call this age group not senior citizens. They're not elderly. We call them kupuna. Kupuna. Everyone say kupuna. All right, that's good. All right, very good. And one of the things that we see in Hawaii, we are actually the #1 state for multi-generational homes. So great-grandpa lives with grandpa, who lives with the parents, who live with the kids, who live with the grandkids, under one roof. The elders, our kupuna, are the most revered, the most respected, the most visited, and part of the family atmosphere 24 hours a day. So what do we do in the hospitals? We put them in an ambulance to your ERs, then up into the inpatient units, and we rip out their social network from them. And on top of that, I see a lot of you guys look cold. Can you imagine our kupuna, who cannot regulate their temperature, and by the way, in Hawaii, most people don't have air conditioning, but in the hospital, because of infection prevention and control, we have to dehumidify the air, and the unintended consequence is this. For 24 hours while I am in pain, and I'm nauseous, and I'm scared, and I don't know what's happening to me. We looked at the census, adjusted it based on our population, and what we noticed is 65 and up is going exponentially higher than the national trend right now in Hawaii. So what are we going to do about it? We had 3 outcomes that we saw as a study. Geriatric population, our kupuna, is rising. The more patients are coming into our acute care settings, 40 to 60% of all of our admissions and all of our HCAHPS responses are from this age group. So interesting. What do you want to focus there? At least now we have the data to actually go to our executive leaders and say, can you please sponsor this hypothesis that we have? And this population is less likely to go home, more likely to need subacute care or SNF. So elderly hospitalized patients have a tendency to get debilitated. We had, last summer, 50 volunteers that we picked out that are all future healthcare professionals, physicians, nurses, technologists, social workers that were going into college, post-grad, and some in senior and high school. And the idea was, I bet you we can do something, take that group, give them some patient experience teachings, help them communicate with our patients, and have them go to the bedside and deploy them that way. But within their scope. We'll talk about a little bit of the creative things we did. So their role and responsibility is solely to be at the bedside of our kupuna that welcome them and want them. And that's truly their role. If you look here on the side, the intentional interactions that they have, they go through the welcome guide. They help them go through that. They give them get well cards. Isn't that a nice gesture of human kindness? The other thing is they offer those warm blankets. They offer earplugs, because we all know that the HCAHPS survey just changed on January 1st. It's now not about quiet at night. It's about R-E-S-T, rest. What did your doctor, nurse, and everybody in the whole hospital do to help you with your rest? So that's interesting. They help them order meals, and then they reorient the patient to the call light, and they scan the room for trip hazards. So we taught them the core behaviors as part of the Queen MOA, which are right here. I do want to focus on the bottom right one, and that's called AID-IT plus M. You guys ready to hear this? And you're probably going to know why I'm telling you this. It's because of our partnership with Press Ganey that said, hey, guess what? Working together, staff working together as a team is the key driver on your key driver report for pretty much every single survey that Press Ganey administers to our patients across the board. It's always in the top 3. Leverage our partnerships with Press Ganey, because in the nursing report, Jeff is in the back. Can you wave at everybody? It's our lovely CNO from Press Ganey. He had brought to Queens the idea of decompression huddles. Everybody know what decompression huddles are? No? Okay, decompression huddles is like an hour before the end of your shift. You do a pause. But we don't call it decompression huddles at Queens. We initiate it and call it maha moments. Maha means in Native Hawaiian to pause, to rest. And because of nursing burnout, our nurses were asked to, hey, an hour before your shift, let's all huddle. The charge nurse initiates it. Let's all huddle. Are you red, yellow, green? How are you doing? What's critical right now? What do you need to get home and not feel any caregiver guilt for things that you may have missed? Who's off tomorrow? Are you off tomorrow? You know what? Enjoy your time off. Don't think about us. We got this. Who's working tomorrow? Get some rest. Rest. Get some rest. It applies to us, too, as caregivers. And that's fresh from last year's nursing report. So what do we all do in healthcare? We develop a program, and we say, you know what? Take this, and let's roll it out. Roll it out. And we expect them to know the behaviors and be totally proficient with it. And that was our thinking when we rolled out the service behaviors to our 50 volunteers last summer. And then I started shadowing them. My team started shadowing them. And I call them our coronial generation. They went to school virtually during the height of coronavirus. That's why I call them the coronials. They're used to wearing shorts and then dressed up nice on the top and being on a video screen. But it doesn't really translate well when you're doing direct patient care for the first time. So what we noticed is they were coming back after doing their assignment, like, Mel, we're done. I'm like, it's only been a half hour. I sent you to like 8 units. How are you back? Oh, they didn't have any work for me. Oh, okay. So we did a Gemba walk. We went to the units and asked the nurses, what do you think our volunteers are doing? Oh, yeah, they're supposed to be supplying and stapling and doing. Yeah, that's the traditional use of the volunteers. We've created the Queen MOA Ambassador Program, and they're here in a different capacity. So we did that, number 1. Number 2, we took them back to our fun lab. So all RNs go through a patient care bundle video simulation training with a patient actor, AKA me as Mr. Aloha. That's my name, my stage name. And we took them into there, and they had to introduce themselves to me. And I was an 85-year-old male patient with cellulitis, with depression. And then they have to work it out as a team. And they learned together. They learned about, and we videotaped. Invest in the youth, in our young adults, who are the future of healthcare. These are the individuals that are going to be taking care of us when we reached that ripe age. We partner with our geriatricians. Why? Because who best to know how to take care of a population with complex comorbidities at an advanced age and understand that? Well, they told me, hey, you know what, Mel? Patients in that age group, they tend to slouch. They have bad posture. They don't take in deep breaths. And one of the things that you can do is, why not have your volunteers give them a pinwheel? Wow, what do you need to do to make the pinwheel move? Okay, hold on, who said that? Good catch. That is a stress ball, and it actually made it to your hand. I'm pretty good at that. But yeah, pinwheels. So they have to take a deep breath and do that. So some of the things that we have in our activity cart, which were informed by our geriatricians, include a couple things. We had large print puzzles. We also had senior dementia-friendly puzzles. So I partnered with our gift shop manager and said, can you source dementia-friendly tools for us? She had to go to England to source that. And that is you utilizing your subject matter experts in a different way to create unity around what you're trying to accomplish. So include your gift shop team as well. We also had senior and dementia-friendly arts and crafts, painting by water, meaning you take a brush and you paint it with water and the picture appears, and then when it dries, you can reuse it again later. So the key that I have to tell you is leverage your partnerships. We not only worked with the geriatricians, we worked with the entire ancillary team, your PT, your OT, your ST, your EVS, your facilities, your gift shop, patient experience, and volunteer services. These are oftentimes silos. And if you have executive sponsorship, which we absolutely did, we were able to break all that. So what are some of the outcomes? You individualize the patient experience based on who's there. So when our volunteers came to the bedside, they actually have to do a pre and post huddle that day with our patient experience team to tell us how their day went. And they also have an asynchronous way of, we have an e-diary for them. It's a survey tool. We love surveys. Why not survey our volunteers? What was meaningful for you? What stood out? What were some of the quotes that you got? And one of them was this woman here on the right, and she was in a semi-private room, and she said, you know, it smelled so good. It smelled like a floral shop. And you know what? That patient has people that love her. What does that imply? Right, that she's not loved. So they came down, they told us, and we said, you know what, go to the gift shop, pick out some flowers, we'll comp it, bring it up to her. That smile that she had was permanent for the rest of her stay until discharge. And she had those flowers on her bedside table right in the front, and anyone that came into the room, she was managing them up, and she was like, somebody loves me. And on the bottom right, we actually partner with our community. So our junior Girl Scout troops who have some art skills, they created these greeting cards that are nice for our patients. I really like the get well soon. Isn't that cute? Since you asked. All right, so at the same time that we created this program, our acute care of the elderly unit was being stood up at the same time, and that's on our Pauahi 4 medical surgical unit. And that summer to December is what this data shows. We were able to decrease length of stay by 2.37 days, and translate that to dollars. How much is that? A lot. I like that. I like that general response, a lot. And you're taking a volunteer program and you're associating outcomes with it for that. Well, but wait, is there more? Yes, there is. Between the hours of 8 and 12, which is when our 50 volunteers that were trained in patient experience went out, we saw a 42% reduction in patient falls. Yes, yes, I love that you're clapping. Just think about the outcomes for the patients. They're not getting injured, no harm is getting to the patient, and these are non-clinical people that want to be clinical later. You're just teaching them what they can do within their scope and changing their paradigm of how they see the room and how they interact with the patient in a meaningful way. So, wait, there's more. HCAHPS, we all care about the hospital consumer assessment for healthcare providers and systems, right? So we did a look back. We took a look during the time that we had them over the summer, and we noticed a 6.2 to 6.5 percentage point increase in HCAHPS overall rating for our kapuna. Wow. Is there like an applause monitor over me? I just had to ask. This is a highlight of the summer program.
behind me, where trouble melts like lemon drops high above the chimney top. That's where somewhere over the rainbow, think to myself, what a wonderful world.
Aloha, I'm Jolene, and these beautiful young people in yellow have come to visit me at the hospital, and they made my stay so much nicer. They brought a lot of joy. Thank you so much. Aloha.
Okay, well, today I had these three awesome people come knock on my door and just walk in, and we had a little bit of exchange about what they're doing, and they're all kind of interested in the medical field and talking about their studies, and I went on and on and on about my life, and it was really a wonderful experience for me. And they helped me by moving things around and helping me get stuff oriented in my room, and it was really great. I really enjoyed sharing with all three of these really awesome people today.
I have one more story that I wanted to share before I continue the presentation. Who knows what this is? Who said dental floss? Oh, good catch. Provided comfort and a really human interaction because they took time to actually hear the story from this patient. Some other feedback is here. These are feedbacks from our patients, our med-surg unit RNs, our geriatric chief. And if you saw in that video, we also sprinkle in things that are going to add value to the future of our Queens Ohana and our volunteers. You saw them on the helipad. You saw them shadowing Dr. Kogan, our geriatrician. And our geriatricians love to take them. And guess what? They get to see what great bedside manner looks like. Because that geriatric clinic is at the 90th percentile every single quarter for likelihood to recommend. And that's where you find the pockets of success, where it's happening in your facility. And you go and you partner with those passionate leaders that are leading that work. And you create this unity, this unified approach towards patient experience, and said, we all have to care about this. You have to care of these volunteers as much as I do. And we do. I tell you, after they complete their 100 hours, we did a graduation for them. We gave them a lei. We had a beautiful reception with our executives, our physicians, our nursing leaders, patients, and just to say thank you. And that way, their parents, their grandparents, their kapuna can see that happening. So with that, you want to spread your successes, right? So I'm proud to announce last month, I actually trained 20 of our local high school for the community hospital at Queens Medical Center, West Oahu. These are all seniors in Waipahu High School, and they're all going pre-nursing, and they're doing an excellent job. So key takeaways, there's a bunch. Your volunteers, we call it the Queen MOA Ambassador Volunteers, but call it whatever makes sense for your organization and your region, and focus on letting them know what a positive impact they have. The only way you can do that is by continuously getting feedback from them. We created multiple opportunities and venues with regular check-ins, with huddles, and to have pre- and post-patient visit huddles. And then the other thing, the virtual piece, we use SurveyMonkey. We gave them a QR code. It's on their clipboard with their assignment sheet. So at the end of their day, they can spend 15 minutes to document what they have. When they graduate, I just print them out, what they've done over 100 hours. And they go, oh my gosh, I forgot about that patient. And then they realize what an impact they're having on their community. And this is the win, especially for a young adult. The attention span is pretty short. You gotta get it, and you gotta be in there, or else they're not gonna come back. And do your direct observations and create the enrichment activities that creates the win for the volunteer as well. Because these are the future employees of your hospital system. The other takeaway that I have is leverage your Press Ganey partnerships and the importance of making data-driven, statistically significant decisions in operations and where to put our human resources in the right way. The other thing is leverage your subject matter experts, find out who they are, and then figure out solutions together. Because I will tell you, some of these solutions I never would have thought of. Provide consistent feedback, and then share your program everywhere. Put it on your internet pages. Put it out in the community. Put it in newsletters. Put it in the news. Put it in emails to your staff. And that generates just this feeling of aloha. They get to see that video, and they all got to do that awe and that feeling like we do make a difference here. And with that, I wanted to say this. This last Hawaiian word I'm going to teach you is mahalo, which means thank you. Thank you for caring enough about your patients to be here today, to hear what I had to say. And I honestly feel that if we can all do some form of this in our organizations, we can make the world a better place. And if we can do that, you're all going to be living with aloha. So with that, I want to say thank you and open it up for questions and answers. Great, we have a mic. Just raise your hand. We have one in the back. Oh, right there. Your name, please, and where you're from.
Jeremy Adney. I'm from Advent Health in Central Florida. This was
Jeremy.
incredibly inspiring, and your joy made it seem like way, way, way less work than we all know that it was to do this. So I think we all appreciate that.
Uh-oh, you're going to get a ball.
Oh, man, the pressure.
The first catch.
I love that.
Caught the ball, dropped my notebook. Operationally, with
Yes.
the volunteers during shifts and whatnot, could you talk to us a little bit about how you structure?
Yes, where's the microphone now? Hi.
Hi,
Aloha.
good morning. I'm Heather Ippolito. I'm with Patient Experience with GEHA, which is actually a federal health plan. I mean, we're the health partner of this Kansas City
Oh,
Chiefs,
you are?
So,
Oh,
yes, we are, absolutely.
Nice.
So,
Very good.
But anyways, we're very intrigued, and I wanted to thank you for the presentation. I'm going to guess I wasn't the only nurse that may have been a bit misty there during the reading some of the kids' feedback, so thank you for that. I do have a question, but I also want to tell you, I'm actually also a veteran, and I live here locally in Orlando. Our local high schools here in Orange County have nursing programs within the high school tracks themselves now, as well as medical tracks and biomedical and a lot of different things that are happening. And that's where my heart was, and that's what I was thinking about during your presentation, because I'm personally going to reach out to our patient experience at the VA here and introduce them to your project, because
I love that.
I'm blown away by this, and truly from my heart, thank you for this, because I could see the impact on a veteran community.
Right.
My question is really on the operational side. Could you speak to just scheduling them, and how long is it, could they do what they could do, but how do they fulfill that 100 hours?
I'm seeing a lot of you nod. Any other questions or insults over here?
Hello, my name's Mariah. I'm from
Hi.
St. Mary's Hospital in Lewiston, Maine. I'm a former junior volunteer at the hospital I'm at. So, and last year I inherited the volunteer program. So I wish I had seen this last spring rather than right now, because I feel like I could have done so much more with our junior volunteer program.
That's
so
okay.
Lots of
You're
questions,
here.
but I'll limit it. I see you have a good group of students. What is your selection process?
My name is Julia Smalley, and I'm from St. Elizabeth Health in Northern Kentucky. And the question is, what does this program cost you?
Remember that acute care of the elderly unit, that med-surg unit? They went from bottom quartile about 6 quarters ago. 4 quarters ago, they were at 62nd. 3 quarters ago, they were at 63rd. 2 quarters ago, they were at 83rd percentile. And this last quarter that ended in December, 93rd percentile nationally. All Press Ganey database, by the way. All right, how many people are going to try something leaving this? Wow, then that's exactly what I wanted to accomplish. I wanted to say thank you for coming. Thank you for your attention. Don't forget to fill out your survey so you can get your CME credits and your continuing education credits. And when you're out in Hawaii, call me up, hit me up. I'll give you a tour of that beautiful campus. Okay, all right, thank you.